podcast, The Randomness of Nothing. This is your host, Rashad Woods. I have an absolute outstanding guest today, and she's the embodiment of the American dream. By way of Jamaica, became a soldier in the U.S. Army, then came through the ranks and became an officer as well. Then, as if this story isn't great enough, she then becomes a medical doctor, right? So you can't make this up. Dr. C.M. Queen Williams, MD. Thank you so much, ma'am.
Yes, thank you for having me. It's a pleasure to be here. It's a blessing indeed. Thank you.
Absolutely. I went to your website. I read the inspirational story. You come from Jamaica, and then you end up going obviously to Rutgers University. And can you just tell us that unique path that you took?
Well, when I first came to America, I came after I graduated high school. My shout out to Merle Grove High School down in Kingston, Jamaica. So I came immediately after I graduated high school. And, when I first came, I was in Miami. And everyone was trying to get you to do track because everyone from Jamaica does track. And, oh, do you want to go to college here? But I just didn't feel like I was ready for college at the time. And I tried some odd hand jobs, working in a restaurant, working in a store. And I didn't think that's what I came to America for. So I saw the commercial, Be All You Could Be. I must have hit my head or something. I pick up the phone and I call the recruiter, say, this can't be it. I'm ready to go. Come get me. And they did. They came to my home, got me, I took the test, all that ASVAB. I wanted to do medicine at the time, but the wait was like 9 months. I was like, no, I got to get out of Miami. If I stay here, nothing good is going to happen. So I did 54 Bravo, which is the nuclear, biological, and chemical warfare type specialist stuff. I do decon. So I was the one, with the gas. You put your mask on, and it was fun at the time. But they lied to me like everybody else. I thought I was going to be in a lab, working in a lab, all that good stuff. Instead, I was in the field half the time with the infantry guys and all of that stuff. It was fun, but it was hard. I'm not going to lie. Being enlisted in the military was no joke back then. So that's how the whole story started with me getting into radiation stuff and getting enlisted. I just knew there was a better path. I wasn't sure how to get there. Prayerfully, I did the military stuff, got enlisted, and I'll stop there in case there are other questions, but that's how it got started. So I didn't straight went to college. I went into the military first. I was broke. I have no money. I'm from Jamaica. I had to get some money somehow. And so when they say be all you could be and the GI Bill and all that stuff, I was like, okay, all right. I think I could do that.
Well, I mean, let's be honest, let's give you a lot of credit because you went into quantum, and in the medicine, you have, titles and pronunciations that, if I don't phonetically sound it out of a dictionary, I can't say it. So, but it's amazing what you do. You're a radiation oncologist as well, too. Is that correct?
Yes.
Yes. Which is absolutely stellar because it's about cancer treatment and you work with the VA as well, too. And there's a number of things that you're highly specialized in. Something so personal as cancer. When you started getting that field of work, obviously want to touch on your military career as well, too. What's that like in the field of cancer research work and cancer care?
So it's funny you say cancer research work because when I was at Rutgers, that's where I started. I started doing research and looking at certain receptors in the brain. I work with mice, etc. But I was doing too much at the time because I was doing track and field. I was ROTC plus a biochemistry major. Something had to give. So I stepped away from research at that time. And so when I looked at going to medical school, I didn't plan on going into cancer. I didn't plan on ending back up doing radiation. I was at the track team. I was a college student athlete at the time. And it's, I have to make this point. The people you hang around, it's important, right? Because they influence you. I didn't think I could go to medical school, to be honest with you. The money part being the biggest portion, because that's a big debt. And so the folks I hang around on the track team, they were all sort of pre-med. I was biochemistry, and I just couldn't see the dream at the time. And so when I started the whole journey to medical school and stuff, you had to choose your specialty. I didn't choose cancer or radiation initially because being athletic, I thought I would go into orthopedic surgery or, physical med and rehab, something along that line. And while I was on a rotation at Walter Reed, this is Walter Reed in DC that's now closed down, I was on a urology rotation and following this patient came from the Marshall Islands. And those who are in the military or deal with stuff, the Marshall Islands, they deal with some stuff out there. I'm going to leave it at that.
Mm-hmm.
So anyway, he came in and was on urology. And all this guy knew was that, he had some kidney stones. And I was fortunate to be part of the surgery. And I'm telling you, this guy's kidney was huge. It was like a basketball. And when you took
Wow.
it out of him, his body shrunk down. Now, I had to go to something else. And when I came back, he had all these markings on his body. I was like, what happened? And the family was asking me questions. So I had to research, well, what happened in that one time I had a test to take, came back? Well, the cancer had then spread to his bones and he had
Oh
to
my
get
gosh.
radiation. And I'm just like,
That's terrible.
radiation, but I studied radiation when I was enlisted. But we talk about atomic bombs and exposure and,
Right. Yeah.
distant time
Yeah.
shielding, not in treating cancer. They always talk about it causing cancer. So that's where the whole cancer part for me and the light bulb went off. Oh, this is it.
Yeah.
I've been dealing with
Yeah.
radiation. This is the route for me. So that's how I got into doing the whole cancer part and focusing with radiation to treat cancer.
Do you find, I know studies, obviously you hear, tidbits of it, but since you're in the field itself, are people, and I say this sensitively, do you see more people more susceptible to certain diseases based on, breakdowns of demographics, so to speak? That people are
Mhm.
more susceptible to, prostate or other type of cancers? Do you see a certain patients that are more likely to receive certain diagnoses?
Well, that's a great question. That's an awesome question, Rashad. And this is known that there are certain demographics or certain culture or certain race that are more prone to get certain type of disease. Now, um, speaking from the African American or from the Black community, prostate
Yeah.
cancer is being, I always say that it's folks tend not to try to go in and get screening, right? And that's one of the things I've done a lot of is trying to advocate to get in. Now, when it
Right.
gets to cancer and certain race, I will speak about what interests me because I am from the Caribbean, I am Black, and so I'm trying to help those who tend to not want to go in and see the doctor, right?
Correct.
And
Yeah.
so when it comes to prostate cancer, and I treat a lot of that because I was in the military, and that's why I'm still working with the VA and doing nexus letters and things, is that being Black is a risk factor for prostate cancer. Just as how you'd say smoking is a risk
Yeah.
factor for lung cancer. Well, being Black, you're at risk for having a more aggressive type of prostate cancer as well. So it doesn't help that if you are in your 40s and you don't know your history. So you have to know if there's a history of cancer that runs in your family. You need to know what your PSA is. And if people are like, "Oh, what's a PSA?" Okay, then you need to have a conversation with your doctor. You need to know your number. And
Yeah.
I always do that when I talk to the congregation, my church. I always try to do cancer awareness. And I always say to the gentleman, you need to know your number. And they're like, "What number?" You need to know your PSA. So there are, for example, also in the Asian community, because sometimes they eat a lot of salted fish, they tend to be more prone to like gastric cancer, gastric being the stomach. So they're more
Okay.
prone to gastric cancer because of their dietary stuff that they eat. And some
Okay.
are also more prone to getting what they call nasopharyngeal cancer, which is like behind the nose area. So there's some, but I'm seeing a shift recently. I'm seeing younger folks getting diagnosed with diseases that are more prone for older folks. So
Yeah.
something like bladder cancer is typically seen in folks in the 60s, and yet I'm seeing folks in the 30s with bladder cancer. Like, what is going on, right? So we have to look at things that are causing some of these things like smoking, how much you're
Yeah.
drinking. So it's not one thing that causes it
Mhm.
more, but I am an advocate. Go get screening. If you're going to go look after your vehicle and you get your oil change and your tire
Yeah.
rotated,
Gotcha.
why are you not
Right.
looking after your own body?
We'll be back after a quick break.
If you are employed or recently found yourself at the exit interview, I have a podcast for you. I'm Mark Carey, the host of the Employee Survival Guide, a podcast all about work and working. As a seasoned employment attorney, I will share with you information your employer definitely does not want you to know about and more. Stop getting screwed over by your employer. Get the tools of the legal trade to fight and win against your employer. Listen to the Employee Survival Guide by clicking the link in the show notes. Enjoy and be well.
Right?
Well, think that, I think that sometimes, the fear of hearing there's something wrong with you, right?
Mhm.
So it sounds like a cliche to say this, but if you have, sometimes if I don't know it, I can wish it away, even if there's like telltale signs of certain things, changes in stool, um, constant fatigue, maybe having blood in stool or urine or things like that. You can't Tylenol that away, so to speak. You know what I mean?
Yeah.
So it's so sensitive because people don't want to believe that there's something wrong with them, and that's such a sensitive topic. And for you to dive into that, I think what I always found fascinating about radiation surgery is like you're taking what could be in your field a dangerous weapon, and you're having it on somebody's body to eradicate a disease, right? And so it's
Mhm.
nuclear medicine.
Well, yeah, it's along that line, but it can cause damage as well. But again, we're focusing the beam to that area. And the way I describe it to patients mostly, it's as though, we're not going to do the whole body because then that would cause problems. I just did a blog on that. A friend reached out regarding radiation exposure, right? That's like for the full
Right.
body. But when we're doing treatment, we're focusing on a specific area. So it's like taking a grape and drying it up into a raisin, right? Then it's no longer functional. Now, if something is close by, it may cause collateral damage, but with the advance in technology now, it's just amazing. From when I started medicine back in 2003 to now, it's like I always tell folks it's similar to like cell phones back then to what we
Oh yeah,
have now.
yeah.
So we have
It's definitely.
advanced quite a bit.
I think what's fascinating is that even like the history of the effects of radiation, we've come a long way from when we had our own soldiers that we dropped the bomb on, in the middle of like Nevada, or it's one of those states, Arizona or Utah, and they're like, hey, stand up, see what happens, right? I watched a
Mhm.
documentary on it. I mean, that was how they learned about the effects of the atomic bomb, right? Or
Mhm.
nuclear weapons. They literally were like, stand up, and then and then obviously what happened to those individuals, they suffered the residual effects of being tested as being the test dummies, so to speak. And then you have areas like Bikini Island, right? Where people who don't know what Bikini Island is, that's where the word bikini came from. It's like, off the coast in near
Mhm.
Australia, New Zealand area. And then they're like,
Mhm.
hey, let's see how these bombs work. And then all these people in this area can't even drink the water and they got sick. So,
Mhm.
it ties into how things have been advanced and more humane with when it comes to
Yeah.
these type of things.
Yes, and we're still learning, even with the Hiroshima Nagasaki stuff. And there were 2 years in my life where I did almost like a sabbatical, and I traveled and I taught about radiation incident and accidents. And I did an article. This was back in 2015, making the radiologist aware that hey, if something go wrong, they're going to call on you. You're going to be
Right.
the one they're going to call on. So
Yeah.
it's fascinating how things go full circle, and I just feel absolutely blessed. And
Mhm.
sometimes the things I do, I wear so many hats, but it's life. As I said, be
Yeah.
lifing, or I'm enjoying what I've been blessed with. So yeah,
Yeah.
I'm willing to talk about and educate
Yeah.
folks on the cancer, on just
Yeah.
being aware of like dirty
Yeah.
bombs and things like that, and
Oh my
how
goodness.
time, distance, shielding, like all of that, it all
Oh my
just come
gosh.
full circle.
It's amazing that you've had such a varied background and you've been able to dive. Your story is so inspirational. And like I said, when I heard you were an oncologist, it makes me step my game up because I can't talk there. Sometimes when I have guests, I can kind of sit back and have some sort of relatability on the topic that they're just I can't even. I couldn't fake this if I tried, right? So like I have no background in medicine. I didn't serve in the military. So like this is all information that you're giving to me on this platform. So, you also talk about women's health. You're based right out of Atlanta, and menopause, which obviously sometimes can be the brunt of jokes in movies and but it's a very serious thing that occurs.
Yes, it is. And, I talk about the menopause from even from a treatment perspective, right? Because that came into being when I was treating prostate cancer and patients are giving hormone therapy and they're like, oh, I'm having all these hot flashes or my body is changing or you turning me into a female. It's like, no, it's doing, it's lowering the testosterone. And so the estrogen is more. And the wives always, I'll say 99% of the time, would say, well, now you know what I'm going through when I'm having menopause.
Right,
But during
right, right.
menopause, it's just a change in your body, and there's a perimenopausal portion time where folks need to be aware. So I got more into it because I'm not a gynecologist or anything along that line. Yes, I do medicine, but I really start to focus on it because treatment can affect, the cancer treatment can affect going into early menopause, right? So if there's something to remove the ovaries or the treatment caused the function to go down, then these symptoms presents itself. So I come from it from a more symptomatic approach and treatment cause symptoms approach as to how to address these experience of perimenopause or menopausal type hot flashes, losing your hair, body changes, feeling tired, etc. But underneath it all, I think the message that I want to leave with your listeners, and you included, Rashad, is that you have to take care of yourselves. You should get your screening. Don't wait for something abnormal to happen, right? You're not going to wear it until your car breaks down. I'm sorry. I used to work in the motor pool when I was enlisted, so I had my own 5-ton truck. So I love using cars as analogy and comparison. So you're not going to wait until your vehicle breaks down. You're better than really any high-brand vehicle there is. More complicated than any. Just go in once a year, take care of yourself. Just check it out. Right.
Yeah. And I know there was a company one time, I think they said it's pretty innovative. The process is very expensive. They have like this really massive machine, and for like 15 or 20 grand, you can get like a test ran on every possible thing that could be affecting your body. Like it's more deeper than a traditional MRI. I saw it on CNBC about a year or two ago. The name escapes me, but for people who would try to, use your local physician, use your local, to get something. I know they offer services in various places, but it's very important to be screened.
It's important to be screened, but I'm not for looking for everything. Because there are a lot of false positive, right? There are lots of false positive. So a lot of time I remember coming up with the MRI, for example, breast cancer. You have to be careful and educate the patient. There may be a false positive. We may see something that means nothing. So you have to take into consideration that you are doing something that can be anxiety producing, right? Because the results are not always available right away. That is why I encourage you to get a family doctor or a primary care doctor that you can have conversations with. No need going to look for brain cancer if you're fine and you don't have any symptoms and there's no need to look for that. There's no need to go looking for stomach issues unless you're having reflux and it's keep going and the medicines doesn't work. There are certain steps for certain things. If the tires on your car is good, you're not just going to change the tires out. It's not necessary. But at the same time, you need to be aware, right? So you just need to be aware. And the full body scan. Go ahead.
No, I was just going to say, no, it makes sense, because you're the doctor. I'm not, you know what I mean?
Well, everyone's trying to be doctor now. They're going on the internet and searching up stuff and they're coming across words and stuff. And the more they read, the more they don't know. It's like this spiral. You're going deeper and deeper. And it's like, look, I may know how to change a tire, but I'm not going to try to fix my own vehicle. Why would you try to do that for your own body? Don't do it.
I would highly advise to listen to the doctor on the podcast that's listening. I just have the fortunate distinction of talking to one. So for people who don't take medical advice from me, that's all I'll say. But to your point, if information is accessible to people, having said that, leave certain matters to people who specialize in those fields of work.
Yes. And, because of the history, I'm very much aware of the history here. There's some trust issues, right, between some folks and the doctors. And so I always tell everyone, whatever you're diagnosed with, your insurance will pay for a second opinion. Right? You can get a second opinion. Don't wait forever. Don't sit on it. If you're diagnosed with whatever it may be, a heart condition, cancer, lung issue, you have the right to get a second opinion. Here I go again. Forgive me, Rashad. Here I go again. No, if you take your vehicle in and this guy telling you you're going to have to pay me $3,000 to do an oil change, you say, okay, thank you very much for your input. And you're going to take it somewhere else.
Yeah, exactly.
Right?
You're not beholden.
Exactly. You're not beholden to one physician. You're not. What I try to tell folks is the bottom line, it's your body.
Absolutely.
We're just here. we work for you, so we're here for you, and there's just certain things that you are supposed to do, and that's how it's a relationship stuff. So let's work
I
together.
think oftentimes when people, like, especially when it comes to a doctor, the relationship can be very, it's not a process you go to willingly, right? You have your appointment. Like, it's one thing if you have something like your haircut, right? You can be picky with like your barber, your nail stylist, and things like that, because that's aesthetically pleasing and you want to be at your best. So you can be kind of critical. You can say thanks, but no thanks, I'm not coming back. But sometimes because of the level of expertise when it comes to a doctor or a dentist or something like that, even people strong personalities can get very, I don't want to say meek, but very, very, I better listen to them because they're the better expert in this than I am. And so you may not get a second opinion. You may take that information at face value. And I'm not in any way, shape, or form bashing the medical profession, but people can really go in their shell when it comes to just nodding their head and saying yes.
Yes, and that's absolutely true. Let me tell you this. I deal with the same thing. I may be a doctor, but let me tell you, my daddy and my mom, when she was alive, bless her. So, like, no, I have to break things down. I am a Caribbean woman, and they're not, no, I'm still the little girl running up and down the street barefoot in Jamaica to them. And so I have to tell my dad, like, look, Dad, you have to do this. This is what, let me talk to your radiation oncologist. Let me talk to this person. Let me, and it's almost like a second look. This little, dimples of this little girl now is this person, and that trust have to be built up. And while I can't be everyone, doctor, I do sometimes do consultation, or I should call it advocacy, regarding cancer. And I provide a sort of a guidance. I won't do a second opinion per se, but it's almost aligned with that. It's more of a guidance as, okay, this is the questions you should ask. This is what you should do next. And I have to do my disclaimer, but because I know sometimes folks want doctors who look like them. Yes. And because there's not a lot of us, I try to empower others and give them the education they need to say, hey, go forth, defend your body, defend yourself, ask these questions, and make sure you understand. It's our job to make sure you understand. Don't be intimidated by us. And I think that's where, for me, where everyone kind of, it's a good relationship I have with my audience, because they know they can ask me anything and I'll just break it down and be true and real to them about whatever they need to know.
That's absolutely wonderful and beautiful. I always, tell every guest this, and, I first of all want a part 2 of this conversation, because I really like to dive deep into the medicines of what you do, and, and be sensitive while talking about those very sensitive topics. But for the purpose of this show, where can people find Dr. C.M. Queen Williams, MD?
Thank you so much for that. So in general, you may find anything you need to find about me at queenquanta.com. I know it's Queen, Queen, Quanta, Quanta.com. Anything you need to find. And remember now, go get your screening, breast, prostate, colon, whatever it is you need to get screened. You go ahead and get screened. That's queenquanta.com. Thank you so much for having me, Rashad.
I love when I went to your website, how it was a take on Einstein's quantum too. So that was, I thought that was very fascinating. Wow. So I'm very appreciative. And like I said, this is a sensitive topic that affects all people. So I appreciate, your inspirational story. And if anybody has listening, you can be the little girl in Jamaica as well too, and live out your dreams. And you just have to take the first step. So thank you for joining me on the show.
Thank you for having me anytime.
I would love to chit chat. I just have to go pick up my daughter.